Hello, good afternoon. My name is Dr. Chudi Ufundu, and it's a big privilege to have one or few minutes to share on this very important topic. So thank you and welcome to our YouTube broadcast. Today we're going to talk about hormone imbalance. Hormone imbalance. And we're going to look at the impact of hormone imbalance on fertility. So if you have a diagnosis of hormone imbalance, how can this impact your ability to become pregnant, and not just becoming pregnant, also successfully carrying your pregnancy to term, going into labor, and having your babies in your hand? So hormone imbalance is very important. We're going to look at the different hormones that can affect the reproductive system of men and reproductive system of women. So we're going to look at hormone imbalance from the female and the male perspective. So please, once you join, introduce yourself. Let's know who you are. Tell us where you're located. My name is Dr. Chudi Ufundu, and every weekend by this time, we will normally select a topic and we discuss the topic. We understand the topic better so we can go better and do better in our communities. So thank you so much. As soon as possible, we're going to start the discussion. I'm going to give my presentation. Afterwards, you will have an opportunity to ask your questions. It's possible that the major reason why you are not becoming pregnant today is because of hormone imbalance, which can be from the man or from the woman. Thankfully, hormone imbalance aspect of infertility is easily treatable if we diagnose and identify it on time. We can fix it. That's the big deal. That's actually an advantage compared to other methods and other types of infertility. If your infertility today is related to the hormones in your body, which are out of sync, we can actually correct that. If we correct that and other factors in the female and the males are constant, you will become pregnant. And I'm not going to waste much time. I'm actually going to start. So there are a couple of hormones that will impact the reproductive system of the women. So I'm going to start with the women, and I'm going to mention a couple of them. Number one, it's estrogen. Estrogen is one of the most important hormones in the body of a woman. Now, when a woman has a normal level of estrogen in the body, what estrogen does, the major role of estrogen is to help in the growth and development of the eggs, which you already have. Remember that when you were coming into this world and God preferred you a lady, God preferred you a girl, you came into this world with all the eggs in your ovaries. So you have two ovaries. So inside your ovaries, you have the eggs, which when you release them, if they are fertilized, you become pregnant. So every woman is coming into this world with the complete set of the eggs you will use to start your family. But until you become of age, until you come of reproductive age, which is the age you will now start releasing the eggs every month through the process of ovulation, those eggs are not going to be functional. So until you come of reproductive age, those eggs are just going to be in your ovaries, getting ready to be used. Now, when you have hormone imbalance, which affects the estrogen, it can be high level of estrogen or low level of estrogen. So if any which way, if the level of estrogen is high or low, it will lead to hormone imbalance in estrogen. So what happens? The basic function of estrogen is no longer going to be there. So estrogen ordinarily will help to prime and mature the eggs, which you already have. So what happens when the estrogen level is either high or low? That function is not going to be there. So a woman will not be able to regulate the development, the growth, and the release of the eggs. This is a key area that estrogen performs the role that makes you a woman. So hormone imbalance related to estrogen will definitely lead to poor or inadequate or completely absent ovulation. Without ovulation, you cannot become pregnant. So ovulation must occur. So ovulation is the process of releasing the eggs you already have. So hormone imbalance related to estrogen will lead to what? either poor or lack of ovulation, that means you will have infertility. Thankfully, when we discover this and we correct it by giving you specific treatment, we can restore back the function of your estrogen, then your fertility will be restored. Now, hormone imbalance can lead to likely gynecological problems, of which polycystic ovarian syndrome is one of them. So polycystic ovarian syndrome can actually induce hormone imbalance in estrogen, which will now lead to infertility. And hormone imbalance can also preempt polycystic ovarian syndrome. Now, women that also have hormone imbalance in estrogen can also experience endometriosis or irregular periods. So these can all be signs that you might likely be having infertility, which is related to hormone imbalance. So we've talked about estrogen. The other important hormone in the body of a woman that will aid in the process of becoming pregnant and actually having your baby is progesterone. Progesterone is a very important hormone in the body of a woman. Progesterone is the pregnancy maintaining hormone. So remember the normal pathway of menstrual cycle. There are a couple of hormones that will come to the body, tell the body, hey, it's about that time of the month, please give me the eggs. Estrogen and progesterone are the two hormones that will go to the cover of your womb, which is called the endometrium, to prepare for implantation. Once implantation is successful, then pregnancy can be carried from first trimester, second trimester, and third trimester. You go into labor, you have your baby. So progesterone is pregnancy maintaining hormone. Now, when you have low progesterone, which is the commonest form of hormone imbalance, pregnancy might not happen in the first place. Or if pregnancy manages to happen, you will likely have miscarriage. So for pregnancy to be carried from first trimester, second trimester, third trimester, and you go into labor, we must have adequate quantity and quality of progesterone. If your progesterone level is decreased, likely you're going to have recurrent miscarriages. So this is why women that will normally have miscarriage, we will normally give them progesterone support. So progesterone is pregnancy maintaining hormone. When you have hormone imbalance coming from progesterone, definitely you're going to struggle, or when you eventually become pregnant, likely that pregnancy will not lead to live baby is very high. Now, another hormone, which is very important, which when the level is either high or low will impact your fertility, is a hormone we call FSH, follicular stimulating hormone. Follicular stimulating hormone, just like the name, is the hormone that goes to the ovaries to actually stimulate the growth of one egg inside a follicle. Now, follicular stimulating hormone is very important. It works hand in hand with estrogen to prepare the eggs. Remember, the concept of ovulation is actually follicular stimulating hormone that will go to the ovaries and tell the ovaries, you know what, estrogen has given me permission. My role is to make sure that the follicles are stimulated. So it's follicular stimulating. So adequate level of follicular stimulating hormone will keep prodding the follicles to grow. Now, at the middle of your cycle, one follicle will grow bigger than the other. That's called the dominant follicle. Inside that dominant follicle is the egg you will release. So it's follicular stimulating hormone that actually leads to growth and release and development of the eggs. When you have higher level of follicular stimulating hormone, is actually an indication that you have decline in your ovarian reserve. Now, ovarian reserve is actually the quantity and the quality of eggs that you will have, out of which you will now use them to start your family. Unfortunately, as a woman is getting older, your ovarian reserve will be depreciating. So by default, as you're getting older, your follicular stimulating hormone will start to increase. Your estrogen will start to decrease as a sign of decline in your fertility. But if we have a sharp increase in your follicular stimulating hormone and a sharp decrease in your progesterone, it's a hallmark you might be going into menopause, which can be normal menopause or premature menopause or early menopause. So estrogen, progesterone, follicular stimulating hormone, very important. Now, another important hormone in a woman which will aid in the process of becoming pregnant and having your baby is a hormone we call the LH, luteinizing hormone. Very, very important hormone. Luteinizing hormone is actually the hormone that will trigger ovulation. So luteinizing hormone is the forerunner. So if you have ever checked if you are ovulating by using ovulation test kit, what you are actually checking is LH hormone. Because just about ovulation time, there will be a sharp rise in the level of LH. It's called an LH surge, luteinizing hormone surge. Now, the significance of luteinizing hormone surge is the fact that once it goes up, in the next 24 hours, the follicle is going to release the egg and ovulation will happen. So anything that affects the LH level will also affect the ability for LH to go and burst that follicle and release the egg. So any imbalance in estrogen, progesterone, follicular stimulating hormone, and luteinizing hormone. So these are the four major hormones. There are other backup hormones that must be within normal range for pregnancy to happen, especially prolactin and thyroid hormones. So if you have higher level of prolactin, a situation we call hyperprolactinemia, likelihood you're going to struggle with your ovulation is there. If you have any derangement in either your thyroid hormones, either hyperthyroidism or hypothyroidism, you are also going to experience infertility. Now, when we come to the man, we are also going to look at the hormones that will likely cause problem. But before then, there are common hormone imbalance situations and how it will affect the fertility. I've already mentioned polycystic ovarian syndrome. When you have polycystic ovarian syndrome, because of all the pathologies out there, it will lead to irregular bleeding. It will lead to irregular cycle. And when you have such, possibility you are not ovulating is very high. And if you can't ovulate, you will struggle. Also, women that have polycystic ovarian syndrome will have insulin resistance, so they will likely be treated with metformin to stabilize insulin so that you can be able to perform your role. Now, some women can also develop hypothyroidism. Hypothyroidism is underactive thyroid. When this happens, you will have ovulation disorders, and some women will be predisposed to having miscarriages. Some women can have hyperthyroidism, which is overactive thyroid, which can also lead to irregular period and ovulation disorders. Some women can also have adrenal gland disorders. So any of this can affect the ability of a woman to become pregnant and the ability for that woman to actually have possibility of becoming a mother. Now, for the men, there are principally three hormones that can also go wrong, but the major one is testosterone. Testosterone is the sexual hormone, and men are supposed to have higher level of testosterone, which will drive their normal reproductive potential. So if your testosterone level is either high or low, you have hormone imbalance. Now, testosterone will help in sperm production and increasing the quality of the sperm. So when your testosterone is low or high, for example, if your testosterone level is low, you will not have libido. So that means you will not have interest in making love with your partner, and indirectly, you're not going to be a father. So low level of testosterone, which we call low T, can be a problem. And it can affect sperm production and the quality of sperm. So it can also lead to poor quality in the motility and the morphology. So the major hormone imbalance that can affect men actually affects testosterone. Now, we also have follicular stimulating hormone in women. Sorry, in men, just like we have in women. We also have luteinizing hormone in men. So if a man has higher level of FSH or lower level of FSH, is also going to affect the possibility of producing sperm, the possibility of making sure that the testicular function is preserved. So hormone imbalance in LH and FSH and testosterone can also affect the man. Now, I've already mentioned common ways that hormone imbalance can affect the woman and what we need to do. Now, the hallmark of hormone imbalance is to diagnose hormone imbalance. So what I mean by that, if we can successfully diagnose that a woman has higher level of estrogen, lower level of estrogen, higher level of progesterone, lower level of progesterone, high FSH, low LH, high LH, testosterone, then we can correct it. So once we make the diagnosis, Correction is very, very simple. So diagnosis and treatment will require hormonal checking. We collect your blood. Sometimes we collect your urine to check the level of your hormones and see where they stand and correct them. Sometimes we can also use ultrasound and some imaging, especially in women that have polycystic ovarian syndrome, to diagnose PCOS. Then we begin treatment. Now, we also will require taking your medical history and looking at you, doing physical examination to come up with what we think might be the problem. Now, especially for women, we are also going to ask you questions about your lifestyle, like your diet, your exercise, your stress management. They will help us to tailor your management, because when you're exercising adequately, when you're eating properly, when you're avoiding stress, possibility that your hormones are going to be balanced will be high. Now, some women will be prescribed fertility drugs. Some men will be prescribed fertility drugs. So, and we can also go through what we call hormone replacement therapy. So any of the hormones we discover that are higher or lower, there are some fertility drugs we can give you to make it to be normal. Now, ultimately, we can also go for assisted reproductive technique. So women that have hormone imbalance that are not responsive to the medical treatment, we can recommend IVF or IUI or surrogacy for them. But it's essential you consult with your gynecologist, you consult with your urologist to confirm that you have hormone imbalance. Hormone imbalance is not something you would diagnose by yourself. You take yourself to the lab and you give yourself a diagnosis of hormone imbalance. You have to take yourself to a gynecologist. We have to take the history. We have to examine you. We have to send you to the lab. Then we have to come out with definitive diagnoses. And we have to know the specific hormones which are out of place, and we fix them. So hormone imbalance, part of infertility, is actually the type of infertility we can manage once we have the right diagnosis. Okay, so thank you so much. That's my presentation. Now I'm going to allow you to ask your questions. So I can see Ngozi from Las Vegas, and I can see Dr. Ndiche in the clinic. Please, will you guys mind asking questions? We have about 10 minutes, so feel free and ask your questions. If today is the first day attending my event, make sure you subscribe to this channel. So before you leave today, click on that subscription button, go to your notifications, make sure you set your notifications to tell you when I normally come live. I come live on YouTube on Saturdays about this time. But right now the clinic is open. Please go ahead and ask your questions. Can I elaborate on low abnormal cervix? Well, I have to explain what I might think you might be trying to ask. So there is nothing like low abnormal cervix. So cervix is not something you measure in quantity like hormones. Cervix is a structure. Cervix is an anatomical structure in the female reproductive system. So this is the vagina. This is the cervix. Cervix is the junction between the vagina and the womb. So you see this junction? This is the cervix, a very important structure in the female reproductive organs, female reproductive system. There are times in the life of a woman we want the cervix to be closed. Then there are times we want the cervix to be open. If you are believing God to become pregnant, we don't want your cervix to be closed. We want your cervix to be open so that when you ejaculate, the semen can pass through the cervix and enter the womb. Unfortunately, some women can have some pathologies in the cervix. They can have what we call cervical stenosis. They can have scary, cervix. They can have adhesions. They can have damage on the cervix. And when that happens, the sperm cannot come in. And of course, pregnancy will not happen. Now, once pregnancy has happened, we don't want your cervix to be open. We want your cervix to be closed, because when pregnancy happens, if the cervix opens, then the baby will escape and you will likely have miscarriage or stillbirth. So there are a couple of pathologies that can happen in the cervix. Now, there are a couple of other things that can happen in the cervix in pregnancy. So I don't know if you're referring to low-lying placenta, which means the placenta is implanted way closer to the cervix, which can lead to a lot of bleeding issues. So your question is kind of confusing, but that's just the role of the cervix in the whole reproductive pathway, okay? So you can rephrase your questions, then I can give you a better feedback. This is why you need to be, okay, so you see what I mean? If your gynecologist, it's dragging in HPV in your cervix, then what happens is this. HPV stands for human papillomavirus, a very deadly viral infection that if it's not diagnosed and if it's not prevented, you can actually use vaccines to prevent human papillomavirus. It's a sexually transmitted infection, which sometimes will not have any signs, but is deadly because HPV can go and cause cervical cancer. Strain 18 and 16 can go to the cervix and be there and cause cancer. So in your situation, what happens whenever you go for your yearly due woman check, we will go for what we call pap smear or pap test. We go to the cervix and we collect some sample to make sure there are no changes in the cervix that might lead to cancer in the future. So we normally go for what? Pap test or pap smear to keep an eye on the cervix. So that's likely why and what your provider is trying to do. So we want to make sure that you don't have human papillomavirus. And of course, we want to make sure that there are no changes in the cervix, which can over time develop into cancer. Human papillomavirus, there are some strains of human papillomavirus that can lead to cervical cancer, anal cancer, vaginal cancer. So that's the reason when we go for those pap smear, we keep an eye to make sure you don't have HPV, and we keep an eye to make sure whatever we need to do, we do that. So that's what's going on in your own situation. Okay? When a woman discovers she has hormonal imbalance after a lab test, can it get back to normal with a change in the lifestyle? Now, what you need to do, you are not doing the right things. You cannot diagnose hormonal imbalance by yourself by just going to the lab. That's a waste of your resources. That's a waste of your money. You don't do that. The appropriate step of seeking help in medical practice is to present to a doctor. When you have symptoms, there are a couple of things you can do at home first aid-wise. So you can take your normal painkillers, but you're not supposed to be taking antibiotics. So assuming you have pain, or as a woman, you have pain, you're bleeding, you're not able to have a baby, you don't take yourself to the lab and you begin to run the test by yourself. Then when the report comes out, you begin to give yourself the diagnosis you don't have. You go to the doctors. When you get to the doctors, we're going to ask you a lot of questions. We ask a lot of questions. That's called history taking. When we are done asking you questions, we examine you. It's called physical examination. When we are done with a physical examination, we're going to send you to the lab. So it's at the point of sending you to the lab, you run all the lab tests, blood, urine, radiological tests, and all that. When the result comes out, we're going to look at that history we took. We're going to look at the physical examination. We're going to look at the lab works. Then we're going to come out with a diagnosis. So at the point of coming out with the diagnosis, that's when we can say, oh, this lady has hormone imbalance. This lady has hormone imbalance in estrogen, progesterone, FSH, thyroid hormones. Then we begin to fix them. Now, if you have hormone imbalance in your estrogen level, which will affect the possibility of you becoming pregnant, and we diagnose you might likely have polycystic ovarian syndrome. Lifestyle modification will help to regularize your hormones while you might be taking other drugs. So lifestyle modification works. So for example, if your body mass index, which is a marker we use in checking if you have a healthy body weight, it's higher or lower than normal, it will affect your ability to become pregnant. Then when you modify your lifestyle and you bring your BMI to the normal level, then your fertility can improve. So stop wasting your resources going to the lab, running the test you don't need, then looking for people to interpret your test result. That's a waste of resources. Stop doing that. If you used to do that, stop. You are wasting money. Go to the doctors, save that money. There are some people that might not necessarily do anything. We'll just give you advice. We'll tell you to go home, drink your water, exercise, eat good food, make love, and you become pregnant. So stop acting the doctor. Let the doctors do what they need to do by themselves, okay? All right. Do we have any other question? Please, if you have questions, quickly ask. Remember the big event for this month, Fertility Masterclass. Natural Fertility Masterclass on the 28th, which is a Sunday. Now, listen to me carefully. If you are challenged, if as of this moment you are not becoming pregnant and you're 35 years and above, and it's 6 months, you need help. You need urgent help, because what's going on in your body? You are 35. When a woman gets to 35, there are changes that will happen in her reproductive system. One of those changes is in the ovaries. At 35, you have a decline in the quantity of eggs you have in your ovaries. You have a depreciation in the quality of the remaining eggs you have. So you're battling with two parameters, quantity and quality. By default, as you're aging, it will happen to every woman. So if you have been practicing play, pray, practice, that means you pray, you make love, and you do everything we've been telling you. And after 6 months, if you are 35 years and above, that means you're 38, 37, 40, you have infertility. Now, that infertility can be primary infertility, secondary infertility. It's at that point you need to go and seek help. So if you're in this category, you need to go and register for the masterclass. Now, if you're younger than 35, you have some advantages. For 12 months, you would have practiced PPP with your partner for 12 months. At the expiration of the 12th month, no pregnancy, you have infertility. So whether you're above 35 or below 35, and after a period of 1 year, no pregnancy, that's the point. You begin to go and seek help appropriately. And that's what we're going to help you to do on the 28th. So please go and register for that event. We have few slots. Once the slots are done with, then we're going to end registration. So please go and register for that event. Okay? Any other question? You have the floor. Whenever you have few people in the clinic, it's actually an advantage because you can ask all your questions. It might actually be like a personal consultation. Then you make good use of the opportunity and you get what you need and you go and modify your life. So do we have any other question? Any which way, eating the appropriate dieting, exercising, avoiding stress will improve your fertility by default. So when you eat properly, when you exercise, when you avoid stress, your fertility as a woman will improve. Your fertility as a man will improve by default. So you don't ever want to eat any nonsense food out there. You don't ever want to be in one place without moving your body. Of course, you have to avoid stress because stress will further make things worse. Things you can't change, let go of them. Let God change it. The things you can change, make sure you change it by yourself. You cannot change the world by just stressing for nothing. Okay? So I'm going to just allow the next 3 minutes to run down so I can close our 30th minute mark. So before then, if you have any questions, feel free and ask. Remember, you can get help. For you to get help, to get a private consultation, you have to be resident in Nigeria. So if you live in Nigeria and you want to be under me, you want to have me review your records, you want to have me review you and be your doctor and refer you, I can do that. But you need to go through the right way. So the right way means you need to get a subscription. So once you get a subscription and you follow the instructions, they're going to connect you to my WhatsApp. And once you come to my WhatsApp, I'm going to take care of you. I'm going to hold your hands until you become pregnant, until you have your baby. You really enjoy this teaching. Please, your advice, you're planning to go back to Nigeria for fertility. Do I reserve your egg immediately or still wait? So it's not a yes and no feedback. Ngozi from Las Vegas. So this is what you need to do. You are 40. You're clocking 40, right? Now, you still have a good chance, even naturally. But you have to understand that at 40, you are running against time. Your fertility is reducing. You are now getting to the zone of action, especially if you have been doing the right things and pregnancy is not happening at 40. You are running against time. It's the time you think outside the box. So personally, if where you're currently living, it's expensive to seek help to start your family, consider going back to Nigeria. When you get to Nigeria, you're fully qualified. We can set you up. We can refer you. You can go for all the options out there. So all the women in our community, please, once you get to age 40, every fertility treatment options must be on the table. Don't remove anything, including donor eggs, including donor sperm, including IVF, including IUI, including surrogacy and adoption. They must be on the table. You cannot remove anything because any of the methods I've mentioned might be what will help you to become pregnant. Now, the beautiful thing about becoming pregnant at this stage, you have an advantage of having multiple pregnancy. So when a woman is older, her advantage of having multiple pregnancy will increase. So God is really a very amazing God. So God knew that when you're getting older, you have fewer eggs, but at that stage, He will give you an advantage. So in as much as you have fewer eggs, possibility you can have twins, triplets, quadruplets above 35 is very high. So it's never over until it's over. Chinyere, welcome. So I've reached my 30th minute mark. At this juncture, I'm going to go. I have a clinic tomorrow. It's going to be in Facebook. So I'll find another topic and we're going to discuss the topic and we're going to continue our conversation. So remember to always pray. Prayer works. There is absolutely nothing that prayer cannot change. So pray yourself out of your problems. Now you cannot just pray because even when God wants to help you, God will give you instructions. So for you to become pregnant, when you have prayed, you have to go and make love with your partner every other day. So that means if you made love today, you can break tomorrow, you continue on Monday, every other day, 48 hourly. Now, when you've prayed and you're making love 48 hourly, you have to practice. So practice means you have to sleep, you have to avoid alcohol, you have to drink water, you have to exercise, you have to get a doctor, you have to be referred, you have to attend master classes. So many of us just want to do what we want to do at the time we want to do that. Unfortunately, you can no longer do that. When you need help, get help. The earlier you get help, the better. Okay? So thank you so much for coming. I hope to see you guys again on YouTube next Saturday. But I hope to see you in our Facebook group tomorrow. And until I see you guys, thank you for coming and enjoy the rest of your evening. And bye-bye for now.